Welcome back. It's now time to discuss some health matters. Now, this time of the year sees a surge in parties, socializing and get-togethers, increasing the risk of the youth contracting sexually transmitted infections, also known as STIs. Research indicates that 6 out of 10 individuals under the age of 25 become more susceptible to STIs during the holidays. To help us dive deeper into this issue, we are now joined by Dr. Cornelia Ndifon, medical doctor at Sterling Medical Center. Dr. Ndifon, good evening.
Good evening.
Thank you so much for being here.
Thank you, and I really appreciate your inviting me to come and talk about.
Oh, it's our pleasure.
Yeah.
Doctor, are there specific precautions that you can talk to us about or considerations related to sexually transmitted diseases during holiday season?
Great. It's a very good place to start from. Like you rightly said, holiday season is a time for partying, getting together, traveling. And sometimes people, let me give this example. Somebody lives in Windhoek, may not even have a relationship, but is going to travel, say, to the north, and maybe might go and encounter a relationship. Mm-hmm, mm-hmm. Others are in a relationship, probably an open one. Others are in a more permanent relationship, and sometimes they don't travel together. So let's take that scenario, but then let's look at youth. Mm-hmm. They are not committed to anything, and it's all hype.
And good times and YOLO.
So with that background and festivities associated with alcohol, drugs, carefree attitude,
right.
I'm relaxing, I'm having fun. But there is a flip side to that. Mm-hmm. There are risks of sexually transmitted infections. And in fact, talking about research, it has been shown that, let's say, in a normal setting, you have like 2% of sexually transmitted infections. Mm-hmm. During holiday, that rate goes up by 3 times.
Wow.
Just during holidays.
Mm-hmm, mm-hmm.
So people need to take precautions. No matter how you are hyping, just be watchful. Mm-hmm. For example, your drink. Somebody shouldn't open a drink for you. If your drink is already open, make sure that it's not spiked, because what can happen, they can put a substance that you drink and you are not aware of your surroundings. Mm-hmm, mm-hmm. You can be raped. That's one risk. 2, even if you are not raped or your drink is not spiked, you overindulge. Mm-hmm. Again, we know alcohol affects our reasoning,
right.
Our judgment, and you are careless. Maybe you even had a condom in your pocket, but because you are so all over the place, you've taken too much. You end up not using it. Mm-hmm. So those are the kind of things. But yes, this is the right time to talk about sexually transmitted infections, because if somebody does get some of this, they have immediate and long-term consequences.
Yeah.
And so the precaution is that when your senses are with you and you want to travel and you think, let me go and have fun, please put condoms. Because if you don't have them, you can't use them. Mm-hmm, mm-hmm. Pack condoms in your bag. 2, if you are that wild risk taker, if it's not too late, you may want to think of PrEP. Because these sexually transmitted infections, there are some that are curable, mm-hmm. and some that are just merely treatable.
Let me interject there, Doctor. We'll get to PrEP in just a second. I want to talk about how individuals should be mindful of their sexual health and behavior during this festive season. And you mentioned about, of course, carrying protection, PrEP. What else can we do? I know a lot of people take the morning after pill as a precautionary measure, but that shouldn't be so.
Yeah, okay. So morning after pill actually strictly refers to prevention of pregnancy.
Right.
But let's look at the sexually transmitted infection directly. So you have the barrier method, and we know of the male condom and the female condom. Mm-hmm. But we don't even talk much about the female condom because it's not being used. So we don't have a lot of data to mm-hmm. back how effective it is. Mm-hmm. But male condom is like be all
right.
for the barrier method. Then the next thing is, like I said, PrEP. But if you are in a good and fixed relationship. Let's say you can't travel with your partner. How long is this holiday that you can't be faithful? So behavior is important. You need to be faithful. You don't need to do anything in this holiday because your partner is not there, whether you're male or female. Okay? Then if you are really like free, I don't have a partner, I'm not committed, you need to use condom. You just cannot throw your life like that. That is what I'm saying. 3, that PrEP. Ask for PrEP. Go to the facilities. Most government facilities are offering PrEP. Just in case something happens, you can protect yourself. But of course, to get PrEP, you need to do an HIV test at least at the spot. And it must be negative for them to give you PrEP. So what am I trying to say? You must plan that, what if I just have to have this sex condom? But I need to be alert of my environment. Control the way you use alcohol. Okay? If you are in a committed relationship and you are going alone, you don't need to cheat, if I can use that word. Can you abstain? You must make sure you abstain.
Yeah.
You make a decision.
I want to go back to PrEP, Doctor, because I think there might also be some miseducation or misunderstanding on how PrEP should be used. So it should actually be used prior to engaging in risky sexual behavior, not after the fact.
No, not after the fact. PrEP is before, after is PEP, post-exposure.
Right.
Yeah, but like I'm saying, people must be conscious. It's like I used to say, you don't just have sex. Sometimes you can plan. In planning to have sex, you need to prepare. I need to have my condoms. I need to go check myself for HIV. And if I'm negative, request for PrEP.
Yeah.
Because you have tablets, you have injections, and actually there is a ring. So then condoms. Now, if you have condoms, you need a clear head to use them. That's why we're saying you can't have condoms and you overdrink and you don't know your whereabouts. Yeah. And maybe the condom is even in your pocket, but you are too weak, too unaware of your environment. Your judgment is poor, and somebody's taking you somewhere.
That risky sexual behavior is directly linked or correlated to alcohol consumption.
Of course, there is a relationship, because we've heard of people, I'm sorry to say, sometimes in a rape situation, 5 or 6 people raping somebody, but sometimes 5 or 6 people actually having sex with somebody which they say consented, but did you consent with a clear mind?
Right.
Maybe you were consenting because you are drowsy, you are tipsy, like they say, you've taken too much, and you cannot, And then there are some people who, we don't know why that behavior, but they just have multiple sexual partners.
Yeah.
It's almost like something, in one way they cannot do without it, in the other way it seems to be normal, maybe because of how they were brought up. So they have multiple sexual partners. And you've even heard of open relationships, like I said. In all of these things, we need to prevent HIV. I used to be HIV clinical mentor when I was with the government. And whatever is happening now, sometimes it doesn't really look new. Our parents, great-grandparents, maybe behave like this, but they didn't have HIV. So when you have something like HIV, then probably we need to change
the behavior.
Yes.
Yeah. And the mindset.
The mindset and all of those things, because HIV is something I call an abomination. Having managed patients with HIV and AIDS, I wouldn't wish anybody to have HIV. But we know what we've gone through as a country and experience. And we can't stop saying that, please, no matter how much you are, just be mindful. Because some STIs, treatable and curable, for example, chlamydia, gonorrhea, syphilis, and what they call trichomoniasis. But there are others that are just treatable, but not curable. Hepatitis B virus, for example, is a sexually transmitted infection. HIV, human immunodeficiency, we know about that. HPV, and herpes simplex virus. These things, even if you don't die, but you are living with them, and you are transmitting.
Right.
And sometimes you're transmitting what has become resistant. So the new person who gets infection is not going to really
I want to ask, Doctor, of these that you've mentioned, which STIs tend to be most prevalent during holiday seasons?
Interestingly, the most prevalent are almost 3 or 4 of those ones that I said are curable. So you're having the same gonorrhea, the chlamydia, is very, very prevalent during holiday time, and trichomoniasis. If you recall, I don't know if it happened in your school, but those days in secondary school, particularly girls' schools, they might have something like a small epidemic where all the girls are itching, either because they were using the same toilet, and when toilets are not, kept in a hygienic state, or even people are sharing panties, and then you get trichomonas, and then vagina itching and all of those complaints, and then people will investigate and, give education. So those are very common: trichomoniasis, syphilis, chlamydia, and gonorrhea. Sorry, not syphilis. In terms of the most prevalent during holiday is HIV, gonorrhea, chlamydia, and trichomoniasis. Yeah.
Speaking on symptoms, what is it that you need to look out for or be aware of in case, you suspect that you've contracted an STI? Okay,
like all infections, they are microorganisms. We don't see them, right? Yeah. So it's not like if you had an unprotected sexual encounter that you will just start shaking because you have been exposed. You don't know whether you've been exposed.
Right.
So my advice is that 10 to 14 days after you feel like, I might have been exposed, because there's what we call prodrome. There's a way your body feels. Maybe I'm not feeling well.
Yeah.
And then your mind might go back to, how was the holiday? They say now things are beginning to settle.
Right.
Then we are trying to say 10 to 14 days from that query possible exposure, you should go and see a doctor. And I believe any good doctor, plus yourself, because if you hide information, it will not help the doctor. But if you express your symptoms and say what happened, I went on holiday, I had this fling, and what, the way I'm feeling, I am having some discharges, I'm itching, my lower around the pelvis is paining me, yeah, then the doctor will ask you further history and should add examination to it, because if there's actual discharge, they will see it. Yeah. And if it's what we call pelvic pain for women, if they do vaginal examination, the woman will be like uncomfortable. Jittery, feeling some pain, and then you can begin to suspect sexually transmitted infection. And most of them, they can be investigated, either by taking what we call a direct vaginal swab. You send to the lab for microscopy, culture, and sensitivity. And sometimes in government setting, there's what we call syndromic management, whereby you may not do a test immediately, or you can just prescribe a set of antibiotics and give the person an appointment to come back to hear whether they are better. And if they are not better, then at this point, you do investigation.
Right.
But in the private practice, we might just want to start with investigations, so that you get the right organism and do the right prescription. It's like hit the nail on the head from the get-go.
I want to know, Doctor, between males and females, who are more susceptible to contracting an STI?
I think it's women. Yeah, and it's mostly biological. It's one of those things, again, like I said, when I was HIV clinical mentor, we used to look at the nature of the woman and the man. So we are all adults, and probably this program, mostly adults are listening to it. So when a man gets erection, they ejaculate, and the woman is like the cup, the collector, and holding that semen with infection or whatever for so long. And when you look at even in steady relationships, or maybe women are looking for babies, they don't even want to get up because they think the sperm will run out.
I've heard that myth before.
Yes, and therefore they lie down so that the sperm
and
can
put the legs up,
so that the sperm can go and meet the egg and fertilize. And that contact time, meanwhile the man is off, even if he doesn't wash. But the woman, that biology, that anatomy allows us to hold the semen for so long. Yeah, and Sorry, let me make you laugh. Once they ejaculate, that is it. They don't suck anything from you,
right.
but they would have ejaculated everything into the body of the woman.
Right.
So whatever infections that are there, the woman is very much at risk, and it has nothing to do with promiscuity. I'm just saying that anatomy. So even if you are the most faithful wife and a man brings infection, it's the same story, like I'm saying. Oh, you are lying there lost in cloud 9 with this semen carrying all this infection. Then it takes time to go into your system, unfortunately.
I think more than ever during the festive season, resources for reliable information on sexual health is important. So where can young people, adults alike, go during the festive season to get this information?
Okay, so thank you very much. Hoping that they will have their smartphones and enough data to go on the internet, on holiday.
Yeah.
Rarely does anybody carry their laptops unless it's a working holiday. So I would recommend CDC, Center for Disease Control.
Right.
So if I will say the mother CDC is based in Atlanta, Georgia. Then WHO website. Okay, and then there are other, if you go say Google and you type something, it is so structured that it will actually direct you to this CDC. So what I'm saying, click on CDC, click on WHO, click on NHS. NHS stands for National Health System of the UK.
Right.
Yeah, I trained in the UK for my 2 master's degrees. And then Mayo Clinic, there are some big names across the globe. You click there and you read. And sometimes they're so good that they have information for the lay person, if you get what I mean.
Yes.
Information for technical people.
Right.
They will even say nurses, doctors, community members. And when you go to the community section, it would have been explained it's factual, but it's so simple that you can understand.
Dr. Difo, always a pleasure having you with us and speaking to you. Thank you so much for your time.
Thank you, Nina. Thank you.
That was Dr. Difo speaking to us about being mindful of the holiday season that seemingly comes with a lot of STIs as well if we are not careful of our sexual activities during the holiday season. As my late grandmother always used to say, prevention is better than cure. So make sure that you're prepared for whatever comes along this holiday season, and of course, be responsible.